going to give 60 units of regular insulin in the SQ now as ordered by the doctor. First, I am going to start by gathering my supplies. I'm going to wash my hands. I'm going to check my vial for any tears or rips around. I'm also going to check my expiration date. I'm going to check my MAR for if I have the correct medication for my patient. 60 units of regular insulin, that is what I have. I have my appropriate syringe of 100 because I need 60 units, so I selected my 100 unit syringe. This syringe is 29 gauge by a half of the needle length. Alright, typically for a SQ injection, you're going to use a 25 to 31 gauge syringe, and then also a 5/8 length or a half length of a needle size. Alright, looks good. I'm going to start by cleaning my vial. I'm going to remove the cap from my vial. We're going to start cleaning the top of the vial for 15 seconds with the alcohol swab. Okay, good. Alright, I'm going to remove the cap of my needle. I'm going to pressurize it for 60 units. Lining the top of the plunger to the line of 60. I'm going to insert it into my vial, into the air portion of my vial. I'm going to insert that air to pressurize it. I'm going to invert my vial. And I'm going to start drying up my medication. Again, matching that top of the plunger to the mark of 60. I'm going to turn over my vial, take it out. I'm going to inspect for any air bubbles. Looks good. I'm going to reinsert it into the cap using the one hand swoop. Alright, got my 60 units of my regular insulin. That looks good. I'm going to wash my hands prior to entering the room. I'm going to again check the MAR to make sure it's 60 units of regular insulin for my patient. I'm going to wash my hands prior to entering the room. Alright, now I'm in my room. I'm going to provide privacy. I'm going to introduce myself. Hi, I am Chelsea. I am going to give you 60 units of your regular insulin in your subcutaneous tissue. I'm going to check the documentation from prior nurses to see where his last injection was, and I'm going to rotate the site. So if he had it on his right upper arm, upper outer of your back arm, about right here, I'm going to do the left, right here. Other sites for SQ injection is your abdominal, your ventral dorsal gluteus, and then your anterior thigh, and then also your upper outer of your back arm. Alright, I'm going to again check my medication to make sure I have it for the right client. Looks like regular insulin of 60 units. I'm going to have the client ask for his name and his date of birth. I'm going to scan his arm wristband if he has one, and then scan my medication to make sure if any allergies or anything else pops up on the screen. I would have also looked up the medication to make sure everything looked good and it wouldn't interfere with any other medication he is using. Alright, so everything looks good. So I'm going to don my gloves. with the alcohol pad, I'm going to cleanse the area from inner to outer. I'm going to let that dry. I'm going to take off my needle cap. And because this is a 1/2 inch length of my needle, I'm going to insert it at 90 degrees versus 45, because 45-degree ankle is for a 5/8. I'm going to lift 2 inches from the skin. I'm going to insert it at 90 degrees, release, and insert that medication. I'm going to remove the needle and then apply pressure. I'm going to do the one-hand swap or swoop again. Dispose of this in the sharp area. Make sure that the area is not bleeding. I would not massage the area. I would just apply gentle pressure to the area. I would remove my gloves and dispose of them. And then I would clean up my workspace and then document.